Hello, people. In just 3 months, the coronavirus has turned the world upside down. But how did it play out so quickly? We take a look back to where it all began. From its origin in Southeast Asia to its acceleration in Europe, US, now in South Asia, as the infection rate increased and countries went into the lockdown, people began to find imaginative and inspiring ways of coping with our new reality. Coronavirus is spreading around the world, but there are still no vaccines to protect the body against the disease it causes, COVID-19. Medical researchers are working hard to change that. Why is coronavirus vaccine important? Simple answer, because people are dying. Now here comes the complicated answer. The virus spreads easily and the majority of the world's population is still vulnerable. A vaccine would provide some protection by training people's immune system to fight the virus so they should not become sick. This would allow lockdowns to be lifted more safely and social distancing norms to go relax. So you can go grab a coffee in Starbucks or go to Wendy's or go to McDonald's. Now comes the different parts of the coronavirus vaccine testing. Preclinical testing. Scientists give the vaccine to animals such as mice or monkeys to see if it produces an immune response. Isn't it harsh on mice and monkeys? Why poor mice and monkeys? We should stand up for them because mice and monkeys' life matters. Oh, I'm just kidding. Scientists are taking great care of them. Then comes the phase 1 safety trials. Scientists give the vaccine to a small number of people to the safety and dosage as well as to confirm that it stimulates the immune system. Oh, you lucky ducks. Phase 2 expanded trials. Scientists give the vaccine to hundreds of people split into groups such as children and the elderly to see if the vaccine acts differently in them. These trials further test the vaccine's safety and ability to stimulate the immune response. At this stage, you will start to smell $1 billion. Phase 3 efficiency trial. Scientists give the vaccine to thousands of people and wait to see how many become infected compared with volunteers who received a placebo. These trials can be determined if the vaccine protects against the coronavirus. Remember, people, when you used to cry when you don't want to go to the school and your mother used to give you chocolate in the name of medicine? Folks, that's a placebo. Now comes the approval. Regulators in each country review the trial results and decide whether to approve the vaccine or not. During the pandemic, a vaccine may receive an emergency use authorization before getting formal approval. Tented $1 billion are ready. Then comes the combined phase, another way to accelerate vaccine development in combined phases. Some coronavirus vaccines are now in phase 1 and phase 2 trials combinedly. For example, in which they are tested for the first time on hundreds of people. Isn't it sounds like a Sheldon Cooper who passed his graduation at the age of 9? Now let's talk about the superpower and invader inventors. Oh no, I'm not talking about the invaders. I'm talking about the great inventors who have most incredible president. Oh, I'm not talking about the France. I'm not talking about the Emmanuel Macron. I'm talking about the man with the golden hair. Yeah, you guessed it right. Donald Jonathan Johnson Jeffrey. Oh, whatever. Trump. Warp Speed. The US government's Operation Warp Speed program is expected to name 5 or more vaccine projects to receive billions of dollars in federal funding before there is proof that the virus works. There comes the first vaccine, the Moderna. The Moderna's vaccine dazzled the stock market in May with the phase 1 on the data of just 8 people, only to see stock prices are dropped when experts had a lukewarm reaction to its result. The vaccine uses messenger RNA to produce viral proteins. Part of Operation Warp Speed, the American company is eyeing to phase 3 trials in July and hope to have a vaccine doses ready by early 2021. Now let's talk about the historical invaders and currently headed by Trump's twin, you guessed it right, Great Britain, England, United Kingdom. Oh wait, this is more confusing than the corona, COVID-19 and Chinese virus. Yeah, a vaccine is in the development by the British-Swedish company AstraZeneca, and the University of Oxford is based on the chimpanzee adenovirus called the ChAdOx1. The vaccine is in a phase 2 or a phase 3 trial in England and a phase 3 trial in the Brazil and South Africa. Supported by the Operation Warp Speed, the project may deliver emergency vaccine by the October. In June, AstraZeneca said their total manufacturing capacity stands at 2 billion doses. Isn't it $1 billion are already in your pocket? The Serum Institute of India, the world's largest vaccine manufacturer, is investing USD 100 million on the potential COVID-19 vaccine being developed at the Oxford University. According to a company official, the Pune-based company has partnered with AstraZeneca, a British biopharma giant, to ensure the equitable supply of AZD 1222 vaccine doses to India as well as low and middle income companies. Let's talk about India, my country. I will not make any jokes here because sub changasi, my countrymen will understand this joke. The country's top drug regulator, Central Drug Standard Control Organization, has granted approval to Bharat Biotech India to conduct human clinical trials of Covaxin, making it the first indigenous COVID-19 vaccine candidate to receive this approval. The firm said on Monday these trials are scheduled to start across the India in July and vaccine is expected to be ready by the end of the year. There are other 120 vaccines under the process all over the globe. But many questions are there. Who gets the vaccine first? Will it be affordable? How it will reach everyone? It is not a matter of how, but when. Both billion lives and $1 billion at its stakes. If you like this podcast, don't forget to subscribe, hit bell, and hit a like and comment down below. Thank you.